Hello everyone, welcome to sqadia.com. This is Dr. Sana Khan and today's lecture is a continuity lecture for the previous lecture. We have talked about the intestinal obstruction, we have talked about the different causes and the classification, the pathophysiology of the intestinal obstruction. But in today's lecture, we will be talking about the acute intestinal obstruction, like the dynamic intestinal obstruction and the adynamic intestinal obstruction. Plus, the intestinal obstruction is also classified as a small bowel obstruction or a large bowel obstruction. So we would be talking about the symptomatic presentation of the small bowel obstruction and the symptomatic presentation for the large bowel obstruction. We would be talking about the supportive management, particularly if you have made a diagnosis of the intestinal obstruction and the patient is coming to you with the constipation, vomiting, abdominal pain, distension, then what supportive management you have to give to your patient? Like you have to restrict the oral intake, you have to impede the patient. Plus, you have to give a good hydration therapy for the fluid and the electrolyte imbalance, and plus you have to do the nasogastric decompression as well. So these are the supportive management in case of the patient who is coming to you with intestinal obstruction. But the definitive management is obviously the surgical options we have available. But we'll be discussing about the supportive management. We will be discussing about the surgical treatment. Like what are the surgical options we have available for the adhesions, what surgical operations we have available for the bands, what kind of the surgeries we're performing in intussusceptions or volvulus, particularly like say the caecal volvulus, the sigmoid volvulus. We will be talking about all these surgical options and modalities available for the intestinal obstruction treatment. We'll be talking about the treatment of the adhesions. Most of the time, you have to put the patient in a conservative management and you have to wait for the 72 hours. And most of the time, the adhesions, they respond to the conservative treatment, and within the 70 or 72 hours, the adhesions, they break away spontaneously. But if the symptoms persist more than the 72 hours, then what you have to do is you have to go for the surgical option, and you have to give a midline incision, you have to open the abdomen, you have to look for, find out the single dominant adhesion, remove that, and you have to leave the rest of the adhesions and give them time to spontaneously resolve. In this particular lecture, we will be talking about the recurrent intestinal obstructions. We will be talking about the intussusceptions, what kind of the procedures we do, like proximally squeezing, distally, we have to squeeze and you have to push back the contents. We will be talking about all this in detail. Plus, in case of the obstruction in case of the neonates, particularly like the bullous vomiting in case of the intestinal atresia, particularly about the duodenal atresia. So you perform the duodenoduodenostomy. So we will be talking about the duodenoduodenostomy in case of the intestinal atresia. And if a patient is presenting to you with a Meconium Ileus, you have to perform the ileostomy. We'll be talking about that as well. In case of the acute large bowel obstruction, what kind of treatment modalities we have available in case of caecal volvulus, surgical options for the caecal volvulus. We will talk about the surgical options for sigmoid volvulus, and then we will be talking about the chronic large bowel obstructions. Particularly like because of the ovarian cancers or the rectal cancers or the sigmoid cancers. These are particularly the chronic large bowel obstructions, and we have the different kind of the treatment modalities. Plus, paralytic ileus is very much common for all those surgeries involving the intestine, and particularly the laparotomies, right? So there can be other causes of the paralytic ileus, like the infective causes or the biological causes as well. So we will be talking about the paralytic ileus, and then we would be talking about the pseudo-obstruction, particularly the Operative syndrome, and what kind of the pharmacological and the surgical options we have available for the pseudo-obstruction. There are different kind of the lectures available on our site, which is sqadia.com. You can go there, you can access to them, and you can learn a lot from there. So thank you for watching today's lecture, and for the detail lecture, keep watching sqadia.com. Thank you.